Okay, so everyone, welcome. 12:02. This session is being recorded. It will be lightly edited and posted to YouTube. I want to remind everyone that chat is not private, so keep it professional. And also, I will be muting people as necessary. Please mute yourself ahead of me if you need to be muted. And so with that as background, I'd like to hand things over to Jim Oakes. Jim?
Well, hello, everybody. Thank you, Joe, for stepping in. This is, an internal medicine qualification qualifies you for a lot of things. I never would have thought that being a Zoom host was one of them, but you handle it very well. So thank you for doing that. And welcome, everyone. We have I'm going to be very quick because I want to get on to the main program. I think it's going to be really interesting today, but just a couple of announcements. First of all, about our meeting next month is going to be on health technology and climate change and how those two interact and how climate change can affect our healthcare technology world. And Ann Rosenblum and Richard Singerman are going to be driving that. And Ann, do you want to say just a word about that program?
Sorry about that. Yeah, well, we're trying to, as you know, climate change is ushering in a new pandemic era. Warming, the world is expanding a range of deadly diseases. And yet we're not really talking too much about climate change in our discussion of social determinants of health. So we're putting together a panel of folks who are indeed worried about this very issue and are part of groups that are addressing this issue. I don't know how much they're going to talk about technology innovation as much as they are about the problem and that it needs technology innovation. But we do have two speakers lined up that we're very excited about. One is the Director of Sustainability at Inova Health System. And because it's certainly a situation that concerns hospitals, as well as a professor and doctor by the name of Mona Sarfati. She's a doc as well as a professor at George Mason University, and she serves as the executive director for the Medical Society Consortium on Climate and Health. And I'm working on one more speaker, and I think we'll have a good program.
Wonderful. Thank you very much. Okay, that's a great segue for today's program because our primary speaker today is Dr. PJ Maddox. I'm going to turn around and introduce her in just a moment, but following Dr. Maddox's talk, we're going to hear for a couple of minutes from Charles Nahabedian, who is the CEO of VideoKall, and we're resurrecting or reconstructing a tradition we've had at times in the past of asking individual members to highlight their companies and what's going on with their company. So he'll spend just a little bit of time on that, and that should be really interesting. Finally, David Main and Deanne Kasim are going to talk a little bit about some of the burgeoning issues on the health policy front. And as David and I talked about that, it turns out that a topic that is getting a lot of energy and a lot of heat is the issue of vaccine passports and what's happening with vaccines and how do you prove you've had one, yada, yada, yada. So this is almost the kind of topic that it might be good that we're doing it by Zoom so people can't throw rotten tomatoes at each other, but maybe you can do that virtually. But with that, let me introduce Dr. Maddox. She is the department chair of the Department of Health Administration and Policy at George Mason University. She's a nurse by background with a long and distinguished career in administration, policy analysis, and research, and has been one of the driving forces behind some of the incredible innovative initiatives in the department and the college. She's received a number of professional awards. The one that I think is most interesting because it's the most recent is that she was just named Faculty of the Year for the College of Health and Human Services. So congratulations, Dr. Maddox. As a researcher, she's been involved in evaluation of state telehealth programs, which of course has a lot to do with what we're doing now. And relevant to today's topic, she has been working with a task force looking at the Arlington initiatives surrounding the move of Amazon to, or flowing from the move of Amazon to establish HQ2 in Arlington. George Mason is a major player in the redevelopment efforts that are taking place there. And Dr. Maddox has been key in determining what the specifics of that will be. She reviewed this with some of the faculty a couple of months ago. We were really excited and asked her to share that with HealthTechNet. So Dr. Maddox, let me turn it over to you, and thank you for being here with us.
Well, thank you. It's really very much a pleasure to be with all of you today. And I have, by the way, made a copy of these slides available to Jim for posting. My contact information is on the end of this. It is the usual proverbial flyby shooting of PowerPoint slides, but just so that there's plenty of information freestanding for you. I'm hoping to conclude in about 30 minutes here, so we have time for question and answers. So let me just say that this is really quite exciting to talk about. I'm a member of the planning team at Mason that is working on Mason's role and preparation, especially with faculty in planning, education, and research around the development of Mason's efforts to increase workforce, as well as provide infrastructure and support for innovation, technology, and digital development. And I'll tell you more about that in just a second. So clearly one of many folks that are working in concert to bring this effort about. By background, as you know, the Commonwealth of Virginia and many in the region work to prepare the let's just say a welcoming environment and meet the needs of Amazon in order to become the selectee for their headquarters to a building that will be located here in Northern Virginia. And so what we'll be talking about today are some of the things that Mason is doing as part of the Arlington Innovation District that is being developed. So really interesting things. Mason itself is not new to innovation or to science and technology development. It really is kind of baked into our early roots. As you know, we are a very, very young university, but most recently, most of our expansion efforts have been around technology and innovation development. We do have multiple campuses, including campuses in Prince William campus, Prince William County, and obviously in Fairfax. Fairfax is still our largest and considered home campus. The other areas are building quite quickly, and one of them is in fact the Arlington campus, which is where most of the efforts we're going to be talking today are centered because of the proximity to Amazon. So the Arlington area, roughly from, as we say, the Potomac Ocean south, is targeted as an innovation district. And there are many participants, including other universities that are participating in the effort. It involves clearly Mason. It involves University of Virginia, Marymount, and GW that are also participating. And I would also say Virginia Tech, who has an expanding university campus that is going to be housed really in the area just at the beginning of the old, if you remember it, Cameron Station is what I'm thinking of. So what Mason is involved in is leveraging public-private partnerships and broader partners in order to create not only a welcoming environment for digital and technology innovation, but actually to engage in broader partnerships in those efforts. And so part of it is the principles that you see before you are those that are guiding Mason's efforts, both in the new building that we are in the process of standing up, as well as the initiatives and the, I would say, the future business research and development opportunities that we are hopeful will emerge from this. Part of it involves a significant investment in expanding education, educational infrastructure and output for a growing workforce that is needed not only by Amazon, but others in the science and tech industry and the broader areas and industries that either utilize those services or are in the business development component of them. We certainly have significant investment in engaging with the local community in these efforts, and you'll hear a little bit more about that as well. Considerable infrastructure investment is being put into entrepreneurship that not only supports Mason technology transfer, but really the broader partners that are going to be participating as well. We are looking to do this as a transdisciplinary research effort. And so there are quite a large number of entities. I can't think of really any at this point, even the arts programs across Mason, that aren't involved in some important way in this effort. We are establishing significant infrastructure, and I said significant other partnerships and technical capabilities, as well as consulting and governance arrangements that support all of these. The Arlington campus itself is going to be expanded considerably as a result of this effort, that being the buildup of the Arlington Innovation District. Right now, the Arlington campus, for those who know it, is primarily comprised of the law school and the School of Public Policy. However, also located as part of the Mason campus is, for those who've been here a long time, you know, the old Hex department store building. That building is in the process of being demolished even as we speak, and in that footprint and on that site will be the new Mason Innovation District building. And so it is going to be the other anchor with the law school on one end and the new innovation building that is on the other end will really be comprise the majority of the building infrastructure for the Mason's Arlington campus. We are putting significant funds into this effort. Some stem from Mason's traditional source funds, but we are also raising funds specifically for this effort and engaging in new and collaborative partnerships with developers that are also participating as co-investors and co-developers of this initiative. And again, I'll be speaking to you more about that. It is a new business model for Mason and one that we are both excited about from a research and development standpoint, but the ability to enhance and we believe move forward in a more rapid way commercialization of innovations, especially technology and digital innovations in this location. Now, to meet our obligations to the community and the community engagement that are very central to this, there are a wide variety of stakeholders that have been brought to the table and are actively engaged in Mason's planning initiatives and those with the other partners in the buildup and the development of the entire Arlington Innovation District. But Mason itself is very involved right now with not only the governance entities with Arlington, but the neighborhood associations, Arlington Public Schools, and others to bring them into and participate in both the planning, but their active engagement from the efforts that will come out of this innovation initiative. And of course, the use of the new research and innovation platform and new building that will be housed in this location. This is the artist rendering of the new building. It is located, the round structure that you see in the lower right of the screen is the location of the law school. The middle square building is the Van Meter School of Public Policy building. And to the left is the new Innovation District building that Mason is in the process of finishing the architectural plans for, is already breaking ground. And of course, for those that have been to the area or will be going by the area, what you're seeing is a large construction zone developing now in what will be the footprint of the new building. It will have direct connection to and easy access to the public, as well as to the Mason buildings and outdoor spaces. As part of this effort, there is more than 225,000 square feet that is associated with what we call Mason-led innovation programming and community engagement spaces. Of this, there's about 120,000 square feet designated specifically for innovation labs, offices, and programming by developers and partners not under the control of Mason. There'll be about 15,000 square feet for retail amenities that will, and public use that will be in the building, particularly in the ground floor area, but on some other floors as well. There's about 146,000 square feet of underground parking that is being planned. And Mason has already engaged in and selected developer teams, both for financing, for architectural planning, and the future co-development of the building. And we did finalize those selections in earlier this year. I would also tell you there is in Vernon Smith Hall, which is a space that is behind the School of Public Policy and that Van Meter building. There is something called Vernon Smith Hall, and in the ground floor of that space, there is a pilot space which has some technology innovations that have been stood up, and I'll tell you a little bit more about that. So while we're in the process of working on it and building the building and developing the partnerships and players associated with the Innovation District efforts, there is a demonstration available for the public and others to see and use right now. And there are business development support infrastructure that's associated with that pilot space, even as we speak. So part of the Innovation District, and a very important part, will involve the development of research and specialty lab environments and spaces in the building. Right now, as we've been looking at the preliminary architectural plans, the second floor will have the majority of the labs and innovative infrastructure for visualization and media intense labs and interactions. There will be robotics laboratories and even manufacturing space, some of which is 2 stories tall, and within the building that will be centered largely in the middle of the building. There will also be human subject and behavioral research space for engaging and testing new technology, new applications, and obviously human subject type of research, and of course the technology and human interface of those things. There will be all of these labs have enhanced securability, but especially on one floor in the location of upper middle of the building. It will be entirely secure and is referred to as an enhanced secure SCIF space for very sensitive research. So there are many special features to the laboratories and the capabilities of laboratories, with the ability of evolving the use of the space, the development of the space and the interactive components of the space and the infrastructure that surrounds their operations. So it's meant to be reconfigurable over time. So not a minor task for the architect and the builder of the building, as you can imagine. So there are different types of labs, as I've mentioned, that are going into it. But again, the idea is to make many of these, if not most of the spaces, reconfigurable over time to both expand them or shrink them, to add technology, infrastructure, and special features based on the specific environment and type of lab that will be required, the amount of, I would say, security or interactive capabilities that are going to be needed. In conjunction with this, there is, as I mentioned, the pilot space that is available right now in Vernon Smith Hall, which not only demonstrates some technology innovations that Mason is working on, but does house infrastructure and support for small business incubation startup infrastructure. Currently, they're demonstrating the health cyber initiative and the mobility, the smart driving technology as what is being featured in the Vernon Smith Hall. So if you have a chance to stop by, I really suggest that you do so. It does get your brain thinking as you actually look at real efforts, things that are not only a pipe dream or something that's being thought about as a possibility, but are actually happening today, and to think about what may happen with the enhancement and the growth of these as they are applied to so many other initiatives, robotics, in information technology, programming, digital innovation, and so forth in the future. This actually, they actually have a dummy and demonstrate some of the new equipment, by the way, in Vernon Smith. So you actually get to see sort of the hands-on component of this and in all of its the application areas. Now, as I mentioned, this in large part is being done in order to not only support the needs of Amazon, but others that are going to be attracted to the region for technology and innovation growth. So as part of this, Mason is enhancing in quite a significant way what we are doing with regard to developing expanded academic programs at the graduate and the undergraduate level in the areas of computer science, information technology, data analytics, cybersecurity, electrical and computer engineering, computational sciences and statistics. And yes, of course, my personal favorite, because we are, the Health Administration and Policy Department is the home of applied data analytics and health informatics at Mason, our bachelor's and through PhD programs there in health informatics. But associated with this, of course, Mason has a number of plans associated with both doing youth summits that are engineering focused for recruitment of a larger pool of entry-level students in the future. There are industry-sponsored hands-on workshops, hack groups that we have teams developing, partnering, and working on every year. Of course, there are capstone, or which are end of program, or bring application of what they're learning in class opportunities. Guest lectures, site tours, and the whole bit are going on now, and will continue to go on, escalating as the new building itself is built. And I would say there are many opportunities for many of you here as members of HealthTechNet to participate in many of those, and we certainly do hope that you do. Mason, a part of this also is Mason has for many years been enhancing its research portfolio and visibility. We are a Research One university, and this year made it into the top tier. That is really quite a feat for a very, very young university, but it is part and parcel of our efforts to be a serious player in research and development, especially in the area related to science, technology, and engineering. So it's not just that we have an interest in Amazon. It's not just that we have an interest in Arlington. We see this as a major effort and an enhancement as part of Mason's overall mission. And our new president, President Washington, clearly is very interested in and sees as an extraordinarily high priority. I don't know of any that is higher myself than the Arlington Innovation District build out efforts, because also not only to enhance research and development and its stimulation, but the public-private partnership component of it, which is quite innovative and important. So as part of that, we're bringing capital, talent, partners of all varieties in the food chain together, along with business advice and startup development for entrepreneurship, as well as infrastructure and technical support. And yes, and a new facility in order to, I would say, fulfill Mason's obligation to the Commonwealth as part of this buildup. We do expect that we will be expanding the technology talent of the workforce at all academic levels, the entry level up through doctoral programs. We do expect that this will contribute significantly to the diversification of the regional economy, and of course, growing research and research translation expertise, including toward its commercialization. We expect quite explicitly to expand our internal and external partnerships. Many of our programs, including my own department, are very engaged in this effort now. And so especially for those of you, since this is HealthTechNet, have an interest in students and faculty research, really would love to hear from you on any of those who are interested along those lines. We are actively, Mason is creating an organized innovation ecosystem in the region, with Mason's own resources being a part of that for our public and business partners. And of course, we hope to serve as a catalyst for adjacent ecosystem development, not the least of which is, you mentioned, you're going to be featuring some of the other areas associated with the quality of the environment, economic development in general, and other equity expansion and other efforts. We have been at this for some time. We've been planning earnestly since Amazon announced it would be moving to Virginia. Mason has rolled up his sleeves and has been working on especially academic program expansions. But the place-based efforts got underway in earnest in March when we began the demolition of that old HEX building that is part of Mason's property, and which is where that new building will be built. We are in the process of finalizing the details of the design while the space is being made ready. We are working on comprehensive agreements already for the public-private partnerships that are actively involved with this. And we do hope that the major part of the building construction we are anticipating to take place begin very early spring of 22 and take place through 25. Mason hopes to take occupancy of the building for Mason's components in summer of 25, with the commercial building occupancy starting in the spring of 26. So that's what's happening in terms of the timeline. As I mentioned, in terms of collaborations, we really my own department is actively engaged in technology and health informatics, as well as management and policy initiatives that support health technology. And we'd love to hear from folks that are interested in sponsoring or have a place for student interns or practicum programs. We do require all of our students to have place-based, unpaid internship and practicum experiences. So we're always looking for more partners there. Do reach out and we can talk with you more about that. But I'm very pleased to also tell you that the department is talking with HealthTechNet, your leadership and planners, about an opportunity to do more outreach and professional networking together, especially where we might engage faculty and students in those efforts more broadly. And we are hoping to do two really innovative professional networking and development outreach programs, one in September as the feature for what is called Mason's Arlington Forward, which is our marketing and public outreach component of the buildup of the Innovation District. We're hoping to be the first up with an event that will be both on at the Van Meter Hall, but also simultaneously simulcast through Zoom in September, and we'll be targeting to do one in March. And I know Jim will be talking with you further about that. But as I mentioned, if anybody is interested in further information, has questions, take them now. My contact information is there. Happy to talk with you about the details of engagement now, especially with those things we are working on in the health information technology, but happy to put you in contact with others that may not so much be involved in health. And then, of course, if you're interested in the partnerships, the business development, or physical space in the new development in the building, Liza Durant, who's the Associate Provost for Strategic Initiatives and very involved in the planning of this, her contact information is there as well. That is my mobile number, and happy to reach you through that. And with that, I can also share with you the partners that Mason is actively working with. The lead developer is Edgemore, the financial partner is Harrison Street, EYP and Clark are our primary contractors, along with Dewberry, Coda Shirley. So gives you an idea of some of the folks that we are engaged and working with even as we speak. But that said, I'm happy to take questions from anyone right now.
Okay, thank you, PJ. Really interesting. Let's do this logistically. Let me ask that you put your questions in chat and I will call on you and make sure you're unmuted so you can ask your question. I've got a couple that have come in already. And first, I'd like to ask Simon Fatal he indicated that he had a couple of thoughts that he thought would be congruent to this. So Simon, are you there?
Yeah, thanks, Jim. I just wanted to, something that I got asked if I wanted to be involved in, and I know that GMU is also actively involved in, so I thought this might be an interesting segue, is the Potomac Quantum Innovation Center, which is a coordinated activity in the world of quantum computing.
Yes.
And George Mason's involved, Maryland Tech is involved. It's a regional thing. All the UMD's involved, Virginia Tech's involved, a whole bunch of different companies are involved. And I was talking to one of the organizers over at Maryland Tech Council, and they said, absolutely, if anyone else in the HealthTechNet environment would be interested in getting involved in discussions about bringing quantum computing expertise and expanding on the quantum computing expertise in our region, please get involved. So if anyone wants to give me a shout, I mean, I'm just as useful as anybody else for making a connection there. So if anyone wants to get involved in that, then just please give me a shout. Okay.
Thank you, Simon. You mentioned University of Maryland. I'm going to cycle back to a question that I think Adam Culberson put out at the very start. And is there any plan to involve universities from either the district or from Maryland in this initiative, or are those separate things?
No, they are a part of, as I mentioned at the beginning, there are universities and other businesses from DC and Maryland that are participating in the Arlington Innovation District development.
Okay.
For instance, Virginia Tech has property in a campus that it is developing. GW and Marymount have campuses already in the Ballston area. And I do not know exactly what they're planning primarily on doing in those footprints necessarily, but there are a number of things that are a number of the community engagement efforts and whatnot are being done across multiple entities. In terms of the building that we're talking about, it is being built by George Mason University and its collective partners. And so I don't know of other universities joining us physically in that particular building, but certainly other members of the broader business community certainly will be. I hope that answers your question. So they, many of them are partnering with the planning, and I believe Anne knows as well from a number of the technology development and planning efforts that are going on more broadly in the region. I think there is an attempt to, bridge what have been, sort of siloed or territorial areas and looking at how others can leverage their collective resources and actually be more proximal to where it makes sense for business purposes, for workforce development purposes, and obviously research and development purposes.
Okay, thank you. Richard Singerman had two questions, one about IRBs and second about research partnerships between new companies and hospital systems. So Richard, what was your question about IRBs?
Hi, Professor Maddox. First of all, thanks for speaking today. So I am currently the VP of clinical research for a fairly new company, about 130 employees. And two of the big issues whenever you're doing like health IT, digital health, is for IT companies to make partnerships with hospitals, because as we know at HealthTechNet, sometimes the timeline for a contract and a CIO dealing with a digital health company sometimes can be like 2 years, which is very long. Mm-hmm. And secondly, on the issue of institutional review boards, digital health is kind of changing some of the models for traditional oversight of research. And obviously research is very important for validating the clinical and or operational effectiveness of a digital intervention. So I was wondering what kind of thoughts have been going into supporting new companies, navigating the institutional review board process, and also partnering with hospital systems to help prove clinical effectiveness. You often need an IRB to prove clinical ineffectiveness if you're going to do research.
Yeah, so there are a number of hospitals and health systems in the area that so I can speak to what I know Mason's involvement is with those entities. I do not know what they might be doing with others. Every hospital or health system typically has its own priorities and its own strategies with regard to how it engages external others in for either research purposes or other broader partnerships. And Inova, of course, locally does have specific partners that it does work with. It is, I know, open to others. Inova, I know, MedStar, Georgetown, GW, all have institutional review boards. So for work that goes on specifically with those entities, it is our experience that even when Mason partners with them, we navigate both our own institutional review board as well as theirs. And so both have to be navigated. And if there are multiple partners, it means navigating Mason and multiple clinical institutional review boards. So that is something that is a part of our world that we do, I would say, all the time. And there is no, that I'm aware of, there is no discussion about an alternative institutional review board that would uniquely be a part of the Arlington infrastructure. My sense is we would probably be using Mason's institutional review board structure and then working with the other partners based on who they might be. But we do that now and do have partners in clinical research and do support those partners' efforts where Mason is involved. If you'd like to speak with me more about what goes on with that and the mechanics of it, we don't do institutional research for individuals that are not partnering with Mason per se, but where Mason is engaged, we can serve as the entity's IRB source. So you're welcome to give me a yell.
I think that's a great one because I've been reading, as of late, there's this kind of push that given initiatives that require regulatory institutional review board review for multiple institutions, there's this kind of push to have only one IRB, and then all of them have to be under the umbrella of one. So it saves a lot of the administrative burden of essentially repeating the process for multiple entities. And so thinking about what you guys are doing, if you had, let's say, a developed expertise specifically to the digital health world, which is very different than the pharma world, which undergoes a lot of IRB, that could be a really nice niche, and especially given Amazon's continuing push into healthcare.
Yeah, I appreciate your comments. It's I very much, I'd like to tell you that I think that's a slam dunk easy thing to do. Probably not so, but something really, to keep our eyes on. But it doesn't mean that we don't have ways of accommodating those needs even now in something less than a perfect world. So that's what I'd like to, I guess, end on a positive note there.
Wonderful. And I'll since I've just got the thing, I just got to ask one thing. I actually live in DC. And I have a place in LA. I purposely have my car in LA, but not here. But I'm only 4 blocks from the yellow line, which, goes right to the airport and one more stop or one stop before to get to where, at least really close where Amazon's going to be. So what are you guys doing as far as a local region for those people that love living in the hip district and don't really want to have a car? I mean, because I know a lot of that is metro accessible, but.
Yeah, well, Mason's building is literally 1 block away from the, there's a Mason stop on the, on Metro. And so there is, there are also plans for enhancing bike lane transportation, other things throughout. There's infrastructure going on in Arlington, even as we speak as well. By the way, it is the building that we're building is going to be a green building and has many really interesting features along those lines.
Oh, that's great.
Yeah, I was quite surprised.
Thank
We had a meeting down there. I apologize for my dog in the background. We were just attacked by a pest control worker. So she clearly had to defend us. But this is like a half a block from the Virginia Square GMU Orange Line stop. So it's very conveniently accessible. PJ, as you know, there are a number of small business owners and small high-tech companies that kind of intersect with us. Who, if one of these companies wanted to talk more seriously about potentially locating in this space, potentially partnering, would you be the person they should reach out to, or is there someone else you would point them to?
The associate provost for outreach is actually the person who they can speak to about the mechanics of the space, the rental mechanics, and all those things. And that's Liza Durant, and her contact information is the last slide of the presentation. So, but they're more than welcome to contact me. I can put them in touch with Liza, or if they want to talk about some things in general before they go further, I'm more than happy to talk with anybody in general about what they're thinking about and get them to the right resource now at Mason or with Liza, specifically with relation to the new building.
Okay, excellent. Well, thank you very much. I don't see any other questions in chat right now. So in failing other questions, I will thank you for your time. I know you have a conflict coming up in just a minute. So, but Dr. Maddox will be available for follow-up and comment. And we very much appreciate your time and this really interesting presentation. Let me, and we're under attack again. I apologize, but let me turn this over to Charles Nahabedian, who's going to tell us a bit about his company, VideoKall. And I'm going to put myself on mute here.
Show us the doggy.
The dog is downstairs defending us at the front door. She's busy.
A vicious mailman, I'm sure.
Absolutely.
Jim, I think Charles might be on
Yeah.
mute. I'm not
Charles,
sure
Charles, you are muted. You need to unmute yourself.
I have
Charles?
tried to do it directly.
Oh, there we go.
Okay, there we go.
Okay.
All right. All right. Now let's see if we can get back to the screen.
Okay. Yeah, we're seeing your screen.
Well, you are.
Yeah.
Okay. Good. Well, the only problem is I don't. Okay. Okay. Do you have the presentation mode up? Just is that in presentation?
No, sir, you're in the like normal edit viewing the slides mode.
Okay. There we go. All right. Hopefully that's coming through okay. Anyway, I'm Charles Nahabedian, CEO of VideoKall, and I thank Jim Oakes and David Main for giving me this opportunity and Ed Harrell for suggesting it. I co-founded VideoKall after spending 20 years at Bell Labs and AT&T introducing new technology. For example, when Disney opened their Epcot theme park, I architected and my team implemented the 40 networked kiosks around the park for opening day, which was revolutionary at that time and guided the park guests through the park. I'm also an experienced entrepreneur. My first startup was sold to LG, which catapulted them into the cell phone business, which they were anxious to get into. So why the transition to healthcare? Well, when I was growing up with my 8 siblings, Dad had to close his store and risk our family income anytime one of us got sick. And so he would drive us to the doctor in the next town. Remarkably, many people still face that same challenge as my family did years ago. So I'm leveraging my deep expertise in computers and telecommunications to propel digital healthcare. My mission is to help provide simple access to quality healthcare so that families don't have to experience similar hardships that I had growing up. So what are the problems? They're manyfold. We could spend a day on all the problems in healthcare. Access is the most significant for patients. 81% of patients are unsatisfied with their healthcare experiences, as it can take days before getting your appointment and hours before seeing a physician. That was before COVID-19. It's only worse now. Fortunately, with the vaccines, it's starting to get a little better. But COVID did lead to a boom in telehealth, as Jim mentioned earlier. But providers must rely mostly on self-reported diagnostics, which makes it challenging to provide an accurate diagnosis. Further, hospitals and clinics face a need to increase revenue and quality and reduce costs. Bad financials have caused many to close their doors altogether, especially in the rural areas. Unless you go to the doctor's office, urgent care, or the ER, or pay for an Uber doc, these are your choices. Current competitors offer kiosks, video-only visits, or mini clinics. No one compares to the model we are offering. Kiosks provide a limited set of diagnostics and primarily for the patient to adjudicate. Video-only visits, whether it's a smartphone or a PC, have limited diagnostics and/or have patient-provided data. They're great for screening, but not for an accurate diagnosis and targeted prescriptions. In office clinics, which are predominantly in CVS and Walgreens and other places, you get a good physical exam, but probably not an EKG. Maybe they don't even have a spirometer, and the patient records may or may not be updated. Of the three, this is the costliest alternative because of a dedicated person there, patient or not. Our solution is a patented chair or clinic that is equipped with telecom technology to provide a clear TV quality visit with a medical provider and telediagnostic instruments that are all remotely controlled by the medical provider from a safe virtual distance, all enabled by a secure private portal. Find a smart clinic location, preload the data into a mobile app for all visits, sit in a chair, and be immediately connected to a provider for a virtual physical exam. The provider remotely controls 11 integrated instruments and automatically records vital signs just as if you were sitting beside the examiner. Your targeted prescriptions can be sent electronically to your pharmacy. Your patient records are updated. On exit, the entire cabin self-sanitizes, leaving a pristine environment for the next patient. We provide patients easy and safe access to healthcare and enable providers to connect with patients in new ways. We use the most appropriate telecom, including satellite and intelligent network with application servers. Our addressable market is $23 billion. We are focusing on families and seniors who can access our cabins conveniently at supermarkets, senior living complexes, corporate work locations, underserved locales, and many other sites. Digital healthcare is growing, and we see a massive opportunity to fill a market gap and ride the wave of growth. We have a talented team that has successfully exited over 10 startups, and we have medical and healthcare specialists to support our wellness initiatives. We have experienced partners in design, manufacturing, and operations, and we're poised to trigger a huge shift in healthcare accessibility. In year 5, we project 3,000 units in revenue, in service, with 3 to 4 market segments in the US alone. For sustainability, we only require 5 patients per day per unit, compared to the 10 or 15 required at pharmacy clinics. So it's a much lower cost of service platform. Break even is within the second year, and we expect an exit in year 3 or 4. We're gaining traction. Our first medical providers are GW and Psych Associates. We've won Northern Virginia Chamber of Commerce Telehealth Award 2 years in a row. Recently received a cash award from the Children's Innovation Challenge. We have an LOI from Welltower for a trial with Sunrise Senior Living. And this year, and I've covered those. Okay. So we're seeking immediately about $500,000 in bridge financing and $4 million in a Series A. We have a signed term sheet for $3.5 million, and we're seeing if there are other possibilities to finance this a lot more quickly. So I thank you for your time and would welcome any questions.
Okay, Charles, thank you very much. That's really interesting. And you and I talked about this company, I want to say a year or so ago, and you've advanced a lot since then. So congratulations.
Thank you. Thank you. Yes, we just shipped our first MVP smart medical chair from the UK last week to get it out from under the COVID lockdown situation.
Okay.
It is, we're starting final assembly and test. That'll be done in about 5 weeks.
Okay.
And we already have GW ready to evaluate it, and we have a cardiology practice in Anchorage that wants to trial it. So we're starting to make progress even with the few funds that we've collected today.
Well, congratulations and good luck. I'm going to segue to vaccines just a moment, and I'm going to move on to David. My wife and I both got our second shots back in mid-March. And I'm beginning to wonder if we made a mistake, because I've now read that Maryland is going to enter all people who get vaccines into a lottery with like a $400,000 first prize. And what I got from getting vaccinated in Virginia was a sore arm and nothing more. So I'm thinking I need to complain to someone. I'm hoping David can point me to who I ought to complain to. But with that, let me turn it over to David and Deanne to talk about what's going on the policy front.
Well, Charles, thank you for your presentation. We've had a long history on and off of featuring some of our members' companies and letting them describe what they're doing and what their needs are to the rest of the members. And I think that's a good tradition, and I'm glad to continue it with you. Deanne, are you on the phone?
I am. Can you hear me?
We can hear you. That's great. Well, Deanne and I and Jim have been talking about what is casually being referred to in many circles as the vaccine passport. And what we thought we would do is kind of tee this subject up. It's a big subject. It's a technically sophisticated one. There are a number of other issues that have arisen in connection with it. And Deanne at Change Healthcare is deeply involved in this subject, but we thought we would raise it today because we had a little bit of extra time to do so in anticipation that at a future meeting, we will go into it in much more detail. But it's all over the news in the sense that the world is pretty much right now, or at least the country, is divided into the vaccinated and the non-vaccinated. And I'm over in Rehoboth Beach, Delaware, land of Joe Biden, where he has a house, and the restrictions in Delaware are supposed to come off today, where people can not wear masks and where they can go into restaurants, which can operate at full capacity. But the caveat is only if you're vaccinated. And when people ask, of course, as we've seen on the news, how do you know who's vaccinated and who isn't? The answer is, well, it's an honor system. And there's a lot of cynicism about that honor system and whether it can be relied upon. But for example, I got a notice yesterday saying that the Health Management Academy was going to start in-person meetings fairly soon, but only for people who have been vaccinated. And so the question really is, of course, on everybody's mind, how do you prove that you're vaccinated? And some people say, well, show them your vaccine card. But vaccine cards, of course, are subject to fraud. It's not very hard to print one out, make it up, put in a signature, and be able to say that that's your vaccine card. And most people who would be on the receiving end of that, whether it's a business or the Health Management Academy or anyone, wouldn't really be able to verify that that's a true vaccine card. So the question then becomes, how can we come up with some sort of an electronic means of proving that you have the ticket, similar to what an airlines would have? And a number of organizations are working on this dilemma, this technological dilemma, as to how you not only have the facility to do it on your iPhone or wherever, but how do you put the data into that facility? and be sure that it's accurate. The big problem now, of course, or one of the big problems, is that the whole issue has become politicized. There are a number of members of Congress and a number of people across the country who do not feel that they should have to get the vaccine. And they certainly don't feel they should be penalized for not getting it by not being able to get into certain events and activities. Europe is being a little bit less apologetic about that. And it's pretty clear that they're going to have a system where you have to document in some way that you are vaccinated, or you will not have the same kind of access that the vaccinated people have. But it's become so politicized that people are now starting to move away from the word passport, because that implies that if you don't have the passport, you won't be able to get in. Now, the many schools, of course, have had this system for years. If you don't have certain types of immunizations, you can't go to school. People don't seem to have the same kind of objection to that, even though those sorts of diseases are seldom fatal. But the result is that even the Biden administration really wants no part of sponsoring and organizing the vaccine, what's now being called vaccine certification or documentation effort. They want to keep government completely out of it. You'd think the ONC or another part of government, DHHS, would coordinate this, but that's really not happening, at least by government. So it seems like it's pretty much up to the private sector at the moment, and there have been a number of meetings and a number of discussions about how to do that. So with that, I'd like Deanne to maybe say a few things about, Deanne, what you've seen as one of those organizations, and how you think technologically this is proceeding at the moment, just as a starter for a future discussion in more detail. And Deanne, thanks for being on. Deanne is traveling at the moment, so she's sort of doing this on the run on audio, but hopefully you'll be able to hear all right.
Thanks for teeing that up, David. I appreciate it. And yeah, indeed, I'm technically on vacation today, so no video for me, so apologies. And thanks, Adam, for putting the vci.org link in the chat. So a little history just to kind of set the table. Sometime, I think it was last year, the middle of last year, the Vaccine Credential Initiative, really a conglomerate of organizations that wanted to look at how to put a digital certificate in place. And there was all kinds of discussions about the how, the what, the fact that our public health systems are so disjointed and the lack of standards across all the states. But really the lighter lift in what we've done at Change Healthcare is to look at digitizing that credential for the low hanging fruit. And what do I mean by that? That's the grocery stores, the pharmacies, really the whole retail experience, with the understanding that getting credentials out of state immunization registries is going to be a heavier, longer term lift. And indeed, yesterday, Change Healthcare put out a press release that we have successfully rolled out our credential initiative, and our first customer will be the Albertsons chains of companies. So if you got a shot at Safeway, you might want to get your credential from us at some point. But that said, I know this raises a whole bunch of issues. Does this create the vaccine versus the vaccinated versus the non-vaccinated? Is it fair? Is it private? And then meanwhile, we have countries like Israel that went ahead and put in their own system, the green card, and were able to open up restrictions on most of their country, if not all, once they hit 60% vaccinated, and using that green card as a pass. First and foremost, as David mentioned, in this country, because so much of this pandemic has been politicized, or hyper-partisan is another word I hear, the important thing to know is this is simply a digital credential. And unfortunately, I think the conversation really swept it up into what is being called a vaccine mandate. You're mandating that I get a vaccine in order to get the credential. And that's just not really true. This is private, it's secure. The only way that this data lives is not on our database, not on someone else's database. It goes strictly to the consumer. Consumer can access it via email and print it out. They can print it out from their mobile device. You can delete it off your mobile device, but you would text a long digit code to credential in our case, and you would answer some questions to verify your identity, birthplace, and birth date, a couple other questions, and you would get this QR code. And again, it's completely controlled by the consumer. And so that was one of the questions that we had to really have a conversation on early on, was there was a lot of privacy experts. And by the way, this is another question that came up. Public health use cases are not covered by HIPAA. I repeatedly see people on Twitter saying that asking about someone's vaccine status is a violation of HIPAA, which is kind of comical to me at this point. And lastly, the other thing is this use case really goes beyond the pandemic. The idea is that in the future, if you think about the information blocking rule and CMS's promoting interoperability rules, both of those really gave the power to the patient, right? To go get your healthcare information through industry standard FHIR-based APIs and direct it to the health app of your choice. Again, putting the patient in charge. And so what we envision is, wouldn't you like to have all your vaccine records at some point, especially if you're a mom, busy mom with kids, and you need to get those regular vaccinations, as David mentioned, to go to school, to go to college, what have you. This would be a digital app to really retrieve all that information in the future, as well as to put reminders in it for vaccines. And hopefully in the even longer term future, interface with CDC and state public health systems to really keep that current and have that bi-directional info flow. But again, that's longer term roadmap. If you follow what's going on with ONC's HITAC at the moment, they have a volunteer public health work group that they spun up to talk about all the things that need to happen for public health IT infrastructure. It's fascinating. One of my colleagues is actually one of the leaders of that group, Erin Malik. And I think there's going to be a lot of conversations that come out of that, possibly for, as David mentioned, a future session for this group. But I know I said a lot, so I'll stop there and see if there's any questions. I see one from Barry Lipsy.
Barry, do you want to go ahead and ask your question?
It wasn't so much a question as just two observations. One, this whole idea of a vaccine passport was, and vaccine equity and health equity was a lengthy discussion between two physicians, public health policy on PBS. I think it was 2 nights ago during the NewsHour show. And then last night, I'm a member of the American College of Healthcare Executives, and this whole idea of mandating vaccines for healthcare workers and clinicians in particular was discussed in the same way that there's a requirement to get, the annual flu shot. And the idea was at the moment, not so much mandating it, but that may change once the vaccine goes from emergency use approval to full FDA approval. So that may be just a point, where we are right now with what they can require, what they're comfortable requiring may change going forward.
Yeah, I would definitely agree with that. I've seen a lot of conversations about even healthcare workers who, at any given facility, still you're looking at maybe 25 to 35% of healthcare workers at acute care facilities or hospitals that have said, no, thank you, I'll wait till it gets final approval. So that's definitely a consideration. One more thing I'll throw out there is Dr. Art Kaplan, who's up at NYU Langone and is just a really well-known bioethicist in the industry. He did an interesting podcast on why he thinks the government in this country needs to get more involved in this. The concern is that why not getting involved in this? Yeah, I understand they don't want to issue a passport or a credential, and that makes sense. But without that, you're going to have all these companies kind of doing what happened in the early days of EHRs, right? None of them talking to each other potentially. And I think that's why certain organizations, Change Healthcare included, are committing to those open standards and joined the Vaccine Credential Initiative to try to make that open standard possible so we don't end up where we were in the early days of EHRs.
So I've got a question for David. Being a scientist and not a lawyer, but I've heard like 3 or 4 states, was it Texas, Oklahoma, have already passed anti-passport regulations, for lack of a better word, not laws against requiring passports. And then I've even noticed in DC, like the YMCA of all places, they just sent out a survey yesterday saying would you feel comfortable if we implemented a requirement that everyone needs to prove that they've had a vaccination in order to take a class? Otherwise, they have to wear a mask. And from a legal point of view, I mean, does that become like discrimination because certain race groups feel less comfortable than others getting vaccination because of previous, let's say, bad experiences? So I don't know when that becomes discrimination.
Well, I'm not sure either. It's so politicized. There are a number of laws making their way through various legislatures across the country having to do with voting rights and all kinds of things. And they certainly have to be tested in the courts down the road. And I think it's all very, very political. Most of them are political statements rather than serious attempts at regulation. Another thing, by the way, that occurred to me was after listening to the news this morning, there are new pronouncements out by Dr. Fauci and others that booster shots are going to be coming along at some point within the next year. And the head of Pfizer as well is saying that in 8 months to a year after your original COVID vaccine, you're going to have to get a booster shot. If that's the case, then the whole idea of showing that you've gotten the booster shot will be added on to getting the original vaccine. Because presumably, if you don't get the booster shot, you're susceptible to getting the virus or spreading the virus at a certain point. So anyway, Deanne, one thing I was going to ask you is,
David,
are you able to, well, go ahead, Linda. I want to ask Deanne a separate question.
Just before you go on, I still have my original international certificate of vaccination that was issued by the World Health Organization. When I first went to Europe in the late 60s, I had to get a series of shots. And if I couldn't prove that I had gotten those shots, I was not going to be allowed back into the US.
Right. Yeah, this
so
is
I mean, it's like this is not a brand new concept. Here's the original document that I had. As a matter of fact, when we flew back into Italy, they wanted to revaccinate us because I had left this in storage in London because I was leaving from London and I didn't want to lose it. And so I had to literally try and convince the Italians that I was vaccinated because otherwise I could not have gotten back into the United States.
Linda, let me just say that's not just back in the day. I have mine right here.
See?
And I still have to have it with me every time I go to Africa.
Okay.
Mostly to prove that I have my yellow fever inoculation. So
All
yeah,
right.
that's
So
still very much alive and active requirement.
It's like Joe Warville has one too.
And I had one when I went to Bosnia. But yeah, you talk about the standard database improving it. For Maryland, at least, they announced that if you're getting entered into the chance for a lottery to win 40 grand a week if you've been vaccinated, they said, and if you were vaccinated previously, they are uploading the data so you will be included in the chance for the lottery. So
I need to move to Maryland to get into that lottery.
Well, but what it means is they've got the data. So if somebody says, "Can you prove you've been vaccinated?" That is, at least in Maryland, apparently, it's going to be in a state database.
So my more serious question is, not that wasn't a serious statement, forgive me, but
that's okay.
What do you, if you're going to get a certification, you're going to get a certificate, what are you going to have? It's at a practical level. What would you show somebody at the entrance to the YMCA or Albertsons or anywhere else? And how is that different from a passport or something like that?
Deanne, you might want to speak to this because you have before.
Sure. Oh, sure. You would actually, Jim, get a QR code, which theoretically could be scanned, whether it's an airline or an event. And you can keep that on your phone as long as you want, or you can delete it, or you can print it out and just have it on a piece of paper. But it would be an individualized, unique QR code. And by the way, every time you go get one, it's more unique data. So in other words, you can't just keep printing them out and give them all to all your friends. It's very specific so that we built security and identification in it.
Okay.
So Deanne, does that mean
Jim?
we could envision like airline flights where every other person has a mask. And I guess if you don't have a mask and the flight attendant comes up to you, I mean, the flight attendant's going to be responsible for asking half the people on the plane aren't wearing masks. Can you show me again that you've been vaccinated? I mean,
Yeah, I don't know if we'll ever get to that point. I have heard, I spoke on this topic about a month ago for the Wilson Center, and we were just talking about the policies and the technologies. And one of the questions that came in from a reporter was, are we going to have vaccinated versus unvaccinated flights? And I said, well, I'm not a lawyer, but I would think that would bring a class action lawsuit one way or another for a whole bunch of reasons. But I do think, for travel, as we get to the point where perhaps we start opening up restrictions. I know the current mask restrictions are supposed to expire. I think it's September is what the FAA said for airlines. But, international travel is always going to have these requirements. And several airlines have said, like Delta made an announcement, I think it was last week, all new hires must have the COVID vaccine. Now, they didn't say anything about existing hires, which kind of made me go, huh? But, it's already starting to come into requirements. And then, of course, when you think about, well, is that fair? Well, it's employment at will. Travel is a privilege, not a must have. So the policy conversations, I've seen them like all over the map on this. I think it's a brave new world and we're just figuring things out.
So Deanne, could you say a few words about which companies in the private sector are actually working on developing that QR code type device, and which ones are collecting the data, if not public health departments, so that it can be populated? What's kind of happening in this development effort?
Sure, good question. If you go to that vci.org, that's just one collection of initiatives. There's another one called the Green Card. But the big ones here in this country, besides Change Healthcare, are IBM, who's putting it on a blockchain. You have Clear, the same company that you can use to get easy access at airports. There's a whole host of smaller companies. There's really so many, I can't keep track of them all. But that's where I think I was saying a little earlier, if we don't start getting this widespread and come up with some rules of the road as to how to use it, where to use it, how that data is going to interface eventually with state immunization registries, we could end up with, EHR version 2, only this time it'll be your vaccine credential.
Interesting. And how are all these companies going to come together with a product, or will there be multiple products ultimately that businesses can choose from or individuals can choose from?
What I've seen so far is it really is the race to get the contracts in place. So I know our team's been scrambling. IBM has, most notably their contract with New York State for Excelsior Pass. Clear has a number of big wins. Everyone has really been scrambling to get the big fish, like the Costco's, the Sam's Clubs, the CVS Health. I think at the next few months is going to be really interesting to see where all the contracts end up. The technology virtually works the same way. You text a code, you verify your identity, and you get your QR code. But in terms of, do we need this many products out there? I mean, there's so many questions that's why I was thinking this might be a great future topic to kind of check in on in a few months and see where we end up.
Could we, I'm wondering, can we ask some questions of Charles?
Sure, is he still on?
I think
Yeah,
so.
I'm still here.
Okay.
Hi, Charles. So I was very interested in your technology because I'm working for a company that does video consult with concept, both coaching as well as tailored content. But I could really see what you're talking about, especially for the elderly population, for that assisted living, senior living, because having had the experience of getting a senior parent, just to the doctor is really, a lot of people don't realize, but if someone's not very mobile or is in a wheelchair, it sometimes takes 45 minutes to get them from a wheelchair into a car and then out of the car and then up to the doctor. And so I could really say, I know that there's physicians that visit these senior homes, but it's kind of interesting, the niche. And of course, kind of the self-cleaning mode is very, very interesting given that we're in the COVID era. But I was just wondering, what areas you're seeing you think are going to be the most promising versus others?
Well, number one, I managed a senior living facility for 8 years. So I have some familiarity with the challenges that they have. Actually had one tenant had to go to a walk-in clinic because she didn't know what her problem was, ended up with a $175 bill. Almost as bad as an Uber doc. The senior living, assisted living, if they don't have a doctor or a nurse practitioner on premises, are very needy in this area. And I asked the executive director of one senior facility, you know, now that I've explained this wonderful technology to you, what do you find most appealing? And the response surprised me. He said, what appeals to me is I can go to a prospective son or daughter of an elderly person and say, we have a nice place here because your parent can always get access to healthcare. Really surprised me. The other area that we found interesting is supermarkets. The supermarkets years ago tried manned clinics like CVS and Walgreens. They take a lot of space, and if you don't have the volume, they really lose a lot of money. Even a reasonably busy CVS needs 10 to 15 patients per day to break even. Our break-even point's a lot lower. So supermarkets would like to try our cabin because it takes less square footage. They will get some money for that square footage, and they hope to get the traffic that they lost and get more prescription revenue back.
Excellent. And if I remember, and David, correct me if I'm wrong, but I believe, wasn't it Dan Gold who's spoken at HealthTechNet quite a few times, who's really, his expertise is in this senior living area? And if so, shouldn't we maybe connect Charles with Dan? Folks remember Dan Gold?
Is David still here? Yeah, David.
I remember him, but we haven't seen him in quite a long while.
Yeah, David, do you remember Dan Gold?
Yes, I do.
So isn't his, I know he spoke a couple of times at HealthTechNet, but isn't his whole expertise in like running like senior living centers and all that kind of thing? And if so, maybe we should connect Charles with Dan. I haven't heard from him in a while.
Yeah, I haven't heard from him in years. So, but well, let's look him up. We've got it all on our website.
Charles,
everything that's happened with HealthTechNet is on our website.
Charles, I'll put Dan's name and maybe you can look him up on LinkedIn and connect with him. But it's Daniel Gold is how he's listed on LinkedIn. You do like search for Dan Gold and like elderly care, and that'll be the right one because there's probably a lot of Dan Golds. But
Richard, also, he's listed as a board member on VitalNet's website.
Okay.
Thank you, Ann.
Sure.
Okay, well, Jim, I'm not sure where you want to take this. We certainly can, back to vaccine passport, we can certainly do more on that in the future meeting. And a number of other players perhaps will be involved in. Jim, I don't know if you want to say anything more about the George Mason initiative that we're undertaking with respect to a meeting in the fall. And
Sure.
I guess one thing I'll add before I turn it over that to you is that we have been talking about when we can resume our in-person meetings. It's not entirely clear, and maybe we'll have to have our own vaccine passport in order to do that. But at some point, we'll be able to do that later in the summer. And so we're looking at places. Certainly, the Nelson Mullins location is available, and it's a large space, and it even has some outdoor, balcony space. But we're also looking at the Arlington campus of George Mason.
Yep.
Okay.
Okay.
This is you don't have to look for parking.
And my connection has just gotten really squirrely. Can you all hear me okay?
Yeah.
Okay. Just to unpack that a little bit for you all, David and I had a really productive meeting, I guess, Wednesday with PJ Maddox and with Dr. Allison Cuellar who are both from George Mason's School of Health Administration and Policy. We met, we toured the Arlington facility, and we talked with them about a possible joint program. I would say, first of all, the Arlington facility is really excellent for our needs. They've got a huge first floor meeting area where we could be as spaced out as we wanted to. And technologically, they could accommodate a hybrid meeting where we could handle both in-person attendance and remote attendance for people who are still not comfortable doing an in-person meeting. We talked about various alternatives. They are really interested in doing an early evening meeting, late afternoon, early evening, in order to maximize exposure to their constituents. So a lot of the Mason students work full time and so couldn't come to a noon meeting, but could come to a late afternoon, early evening meeting. So we've penciled in, subject to reviewing this with the HealthTechNet program committee, a late afternoon, evening meeting on September 23rd, which is a Thursday. We're hoping with Deanne's leadership to get a speaker from the Office of the National Coordinator, probably the deputy, and to be able to flesh that out with a panel. So a lot of work to be done and a lot of specifics yet to be arranged, but the Mason people are pretty enthusiastic about it, and I'm hoping we can move ahead and work this out. So we're looking now for, there's a doodle poll out to the program committee. We're hoping to be able to get a program committee meeting in the next couple of weeks to flesh this out and get some specifics to let you all know about.
And we're also hoping that that evening meeting includes a cocktail party.
Yes.
To celebrate getting back together personally. I'm afraid I'm going to have to go, Jim, to a 1:30 conference call in a second, but thanks for putting all this together, and
yeah,
everybody could attend.
Well, I think this is probably a good time to wrap it up. So thanks to you all for coming. Joe, thanks so much for stepping in and being the acting Dr. Nick today. You handled that flawlessly, and we appreciate it.